Prescription for Addiction, a Failed Experiment, your second psychiatric consultation. Today we're going to talk about addiction among the mentally ill. From 1975 till 1977, I was practicing psychiatry at Henry Ford Hospital and teaching residents in psychiatry at Henry Ford Hospital. I found that many of my psychiatric patients were addicted. I reviewed the medical literature on treatment of drug and alcohol addiction. In 1977, the only difference between a successful and an unsuccessful drug or alcohol treatment program was attendance. Successful programs had good attendance and unsuccessful programs had poor attendance. The successful programs for drug and alcohol addiction in 1977 did not have better relapse rates than unsuccessful programs. The successful programs for drug and alcohol addiction in 1977 did not have better employment rates than unsuccessful programs. The successful programs for drug and alcohol addiction in 1977 did not have better marital success rates than unsuccessful programs. There were no identifiable differences between successful drug and alcohol programs and unsuccessful drug and alcohol programs beyond attendance, except maybe billing and revenues for the hospitals and other healthcare providers. I do not know if this has changed significantly. In view of the breadth and depth of addiction in this country, I have little reason to believe that anything has changed since 1977. Karen Ann Quinlan, born March 29, 1954, died June 11, 1985, went into respiratory arrest when she mixed alcohol and Valium in 19. She never came out of the coma and died in 1985. She overdosed with the alcohol and Valium in 1975. There were many newspaper articles about her coma, and she became the poster girl for the end game in drug and alcohol addiction and mixing drugs and alcohol. In 1975 or 1976, I gave a prescription for Valium to a patient with anxiety. I warned him of its sedation and dangers with alcohol, driving, and dangerous machinery. Of course, I was subpoenaed to court. I went to court. His attorney asked, "Did you bring his medical records?" I answered no. He asked, "Do you remember prescribing the Valium?" I said no. The attorney had me the prescription bottle and asked, "Did you write this prescription?" I read the bottle. It had the patient's name on it, my name and address, and it was a prescription for Valium with a warning to be cautious with driving and dangerous machinery. I answered yes. I saw him on that date, and that is how I write my prescriptions. He then said, You're excused. I asked, "I am here, but I don't have to testify and I can go back to work." He answered, "You don't have to testify and you can go back to work." I left and never saw that patient again. To this day, I do not know what happened in that courtroom. After that, I stopped starting patients on addicting medications. After that, I only ordered addicting medications as a taper off of addicting medications started by other psychiatrists except for rare cases. Zolpidem was approved in the United States in 1992 under the brand name Ambien. Ambien is addictive. Addicting medications have the property called tolerance. The body adjusts to the effects and it takes larger doses to achieve the original effect. It is estimated that 60 million Americans suffer from insomnia. It is also estimated that over 35 million Americans use Ambien for insomnia. Ambien loses effect after about 14 days, but most patients continue taking Ambien after 14 days. Ambien has other serious side effects: memory loss, difficulty concentrating, disorientation to place or time, loss of emotional affect, loss of pleasure in daily life, depression, suicidal thoughts or suicidal attempts, anxiety, sleep disturbance, nightmares, sleepwalking. Serious consideration should be given to dissociative states associated with Ambien and other sedative hypnotic medications. In 2011, an article was published describing zolpidem-associated complex behaviors, including both daytime automatisms and sleep-related parasomnias. Sleepwalking and other activities while sleepwalking include eating, driving, having sex, and holding conversations with other people. The benzodiazepines and other sedative hypnotics have been implicated in sleepwalking and other parasomnias. Quote, the Ambien defense, unquote, for criminal behavior is the subject of an article in the Journal of the American Academy of Psychiatry and Law. The article details many instances in which zolpidem allegedly influenced strange actions, including criminal behavior as serious as murder. As a medical director of the Bowen Center in Warsaw, Indiana from 1991 to 2001, I had a number of patients come to me on Valium 10 milligrams 4 times a day for many years. I told them I did not want to prescribe addictive medications. They insisted, and I felt I was under ethical coercion to prescribe the Valium. I resolved the ethical dilemma by prescribing a Valium taper. I gave the patient a prescription for Valium 10 milligrams 3 times a day for 90 days, then 10 milligrams twice a day for 90 days, then 10 milligrams once a day for 90 days. After the last prescription, a number of these patients sent letters of complaint to the Indiana Attorney General alleging that tapering them off Valium was abuse. I received a letter from the Indiana Attorney General stating that I had 2 weeks to respond to avoid action on his part. One time I came back from a week's vacation with only 1 week to reply. I wondered what would have happened if I had taken a 3-week vacation. In any event, I submitted a form letter. Dear Attorney General, I have in hand your letter that John Doe has submitted a complaint that I was negligent and otherwise abusive for not continuing to prescribe Valium for his anxiety. Please be advised that Valium, Xanax, Ativan, and other benzodiazepines are addicting and should only be used for a few days before or after surgery or some other equally stressful event. Because these medications are addicting, they should not be used for long periods of time. Because it was my belief that it was not in this patient's best interest to continue these medications, I placed him on a taper. He arrived on Valium 10 milligrams 4 times a day. I advised him I was tapering him off the medications. I gave the patient a prescription for Valium 10 milligrams 3 times a day for 90 days. Then I gave the patient a prescription for 10 milligrams twice a day for 90 days. Then I gave the patient a prescription for 10 milligrams once a day for 90 days. After waiting until the final prescription was offered, the patient stopped seeing me, files a complaint, and I now submit this missive in answer. Thank you, William R. Yee, MD. The Indiana Attorney General accepted my form letters and took no further action against me. While I was in Indiana, I had a patient with schizophrenia ask me for Valium. I refused and explained that he had a chronic condition. I further explained that Valium was only useful for short periods, and Valium and alcohol were in fact dangerous when combined with his psychotropic medications. Of course, he went doctor shopping in Fort Wayne, Indiana. He found a doctor who prescribed Valium. He died from an overdose of Valium and alcohol and his psychotropic medications. I had also advised him against the use of alcohol with the psychotropic medications. It was my belief that in addition to having schizophrenia, he was an alcoholic and drug addict. Generally, prior to 2000, physicians avoided prescribing opiates for pain except for a few days after surgery or injury while a serious wound healed. Third parties intervened with the assertion that patients were suffering from chronic pain and physicians lacked compassion and were not prescribing enough opiates to provide relief from pain. I will continue with this topic tomorrow. That is all for today. Thank you for your time and your kindness. Have a great day.